I'm Sue Cutshall. I'm an integrative health specialist for the Department of Surgery and a clinical nurse specialist and advanced holistic nurse. The Healing Enhancement Program actually started about 7 years ago as a concept or a group team getting together to look at how we could improve pain management for our patients. And as we did some typical things, bringing medications into practice, we found out that there's a lot more to it than just pain, that there's anxiety, tension, and all that goes into the patient's experience. So we came together looking at all the things we could do to enhance healing for patients after surgery and went into the realm of actually adding some complementary therapies into our practice. So things like massage, music, other things that can make people feel a little bit better and maybe help them heal before or after surgery. We initially had a team that came together and looking at pain management, but we really went back to patient feedback. So we wanted to be very, very patient-centered, see what their overall experience was and what some of their concerns were. So when we listened to patient stories, they talked about pain being back, neck, and shoulder pain, more musculoskeletal, so things like massage might be beneficial. We also saw that patients were listening to some music on their own, so we wanted to be able to help encourage that and have that more accessible. We also learned that patients were talking about the anxiety they had, the stress, thinking about surgery, which would be expected. So then we started looking at things that might help them with that and some of the research that was out there as well for those things. So it was really kind of driven by what the patients were experiencing and us actually listening to those concerns and trying to pay attention to all of their needs, whether it be physical, emotional, or spiritual. There is a CD player in each patient room, so patients can bring their own music that they want to listen to if they don't have a player. We also encourage people to bring their own CD players or iPods with them. We do have some selections on the unit, and the patient library has selections as well as even the TV system has selections. And a few rooms have some surround sound systems to look at more specific music. Ambient music is what we call it, which has nature sounds connected to it. So kind of a trial research study that we're doing. We also have a couple of massage therapists that offer back, neck, and shoulder massage after surgery, which has really helped with that musculoskeletal pain that patients are experiencing. Probably the most popular folks on our units. Massage is very much needed, and we get great responses to it. And then we have volunteers that do hand massage as well, so they'll do that for patients, visitors, and even sometimes staff, if staff are having a bad day and they really need a little bit of relaxation as well. So that's been a nice addition. We also have selections of CDs and guided imagery for successful surgery to kind of help you prepare mentally before surgery and after, and we send those to patients before surgery or have them available on the units. And we have some guided meditations for sleep as well, because patients sometimes have a hard time sleeping before or after surgery, either anticipating or just being in an environment where sometimes it's hard to sleep. And then we have stress classes on the unit, and we also have healing movement classes that patients or families can go to. More often it's family members that attend those because they're also going through an experience of stress. And sometimes some easy movements, even for patients, can help them with their flexibility and balance right after surgery and aid in their recovery. And then we also have some folks, dietitians, that teach some healing type diet classes on the units as well. So patients are getting the most up-to-date feedback on what would be the best type of heart-healthy diet to follow. I think the biggest benefit for patients is having some options for them to help with their experience of surgery and really helping them mentally prepare for surgery and afterwards, which are things that we didn't necessarily pay attention to before. So we're really paying attention to their individual needs and being able to have some options for them. And the feedback has been very positive from patients, from families. We've gotten several letters of recognition to continue to keep forward moving with these types of programs. I think our team really wants to focus on overall wellness and health promotion for our patients. So adding things into our standard practice that can help promote nutrition or diet, exercise or movement type of activities, and then things for stress management, which fits in the realm of adding those complementary therapies that our people are using to help with their stress management and help with relaxation. So definitely fits within that realm to give people a good start on their recovery and access towards their wellness. There's national data showing that more and more hospitals are offering these services because patients are demanding them, they're interested in them, they're using it for their own health and well-being outside of the hospital, so why not add that into their care while they're here as an option when they're sick and not feeling as well, to help them with the process. And that even within our local area, hospitals are looking at adding these as well.